HIV transmission through transfusion. Human immunodeficiency virus is a member of the retroviruses family and causes acquired immunodeficiency syndrome. Transmission of HIV can occur through body fluids such as blood, semen, vaginal fluids and breast milk. Though the chances are rare, a person who receives the infected blood is likely to develop an HIV infection. About 5 to 10% of HIV transmissions are due to transfusions. The HIV can be present in the blood for long periods. They have long incubation period before the appearance of clinical signs. They are stable at the 4 degrees Celsius or lower, at which blood and individual blood components are stored. They can replicate after a blood transfusion. The risk of getting HIV from blood transfusion depends on the prevalence of HIV in the donor population, donation during the window phase of infection, sensitivity of screening tests to detect HIV antibody, unit of blood or blood products received, and human and operational error. The first case of HIV infection resulting from blood transfusion is reported in the year 1982. HIV screening was introduced in the year 1985 to identify infected blood donations. If they are tested positive, the collected blood is safely discarded. As a result, the risk of HIV transmission from a blood transfusion is very low. Screening tests includes rapid test, enzyme-linked immunosorbent assay, chemiluminescence assay and nucleic acid amplification testing. Rapid screening tests detects both antigen and antibodies. The tests have 99% sensitivity. It requires a blood drop from the finger, an oral swab from gums or urine sample for the analysis. Tests results are available within 1 to 2 hours. Enzyme-linked immunosorbent assay is the standard screening test with 99.5% sensitivity. It measures antibodies, antigens and glycoproteins in biological samples. The test requires a blood drop from finger, an oral swab from gums for analysis. Test results may take days to weeks. 4th generation ELISA can detect both HIV antibodies and P24 antigens, while the older generation can only check for antibodies. Chemiluminescence assays are alternative tests for conventional ELISA test. It can detect both HIV antibodies and P24 antigens. Nucleic acid amplification testing helps to identify the presence of HIV RNA, which is the nucleic acid that carries the HIV genetic information. It requires plasma or serum specimens for analysis. They are highly sensitive and specific tests and can detect HIV infection from 10 to 12 days after incubation. Main limitations of HIV screening: the lack of universal screening methods of blood donations. The antigen and polymerase chain reaction tests are expensive and are not recommended of blood donations in developing countries. To reduce the risk of using infected blood, the donors should be informed about the risk of transmission of blood-borne infections such as HIV. A set of standard questions should be asked to donors to assess their general health. Ineligible candidates should be identified, such as sex workers or people who inject drugs. Postpone blood donation if the donor have tattoo or body piercing. Perform screening for HIV antibodies to improve the blood safety. Use blood or blood plasma alternatives, e.g., simple crystalloids.